Now, as the new daily numbers for COVID-19 continue to increase, there is still some concern in some quarters about the risk of transmission and infection in primary schools. The Department of Basic Education took the decision to allow normal daily primary school attendance after the June holidays. Meanwhile, other organizations as well as unions are in full support of the move. For a conversation around the likelihood of primary school children being infected, I'm joined now by the SA Pediatrics Association's President, Professor Minyo Makalach, and a bit later on also Mr. Andre de Bruin, who is the Educators Union of South Africa's National Executive Media Officer, will be joining us. Let's start with you, Professor. First and foremost, thank you for your time today. What is the likelihood of children being infected with COVID-19? We know when COVID-19 first started, children were ring-fenced, and it really was described as a disease that will affect just adults.
Thank you for having me on your show. And I think nothing really has changed. We know that this is mainly a disease of adults, and specifically people with comorbidities. From a children's point of view, there's been some concern that possibly the older teenagers, the sort of 17, 18 and 19-year-olds may be a problem. We know that children, specifically primary school children, are not affected severely at any rate. So if you have children who may have it, it's going to be a very mild infection, and they are less contagious than adults would be as well. And our support is of the government in getting kids back to school on a daily basis, provided they do the mask wearing, the hand sanitizing, and the distancing. So those are the three golden rules, and I think that holds for adults and for children. But our concern is that children are really losing out. This is the second year now that we're not getting them back to school properly. And we know that schooling is not just about learning, it's about safety. A lot of these kids are running around in the streets on their own while their parents are back at work. It's also about psychological safety and physical safety. And a lot of children, especially in the primary school years, would get a meal in the middle of the day at school. And we feel that these children are also going hungry. So we are in full support of getting kids back to school. Online learning is really not a reality in most of the children in South Africa. And we just think we've lost a year of education. If we lose a second year, this is going to last a very long time. And so we're very much in support of getting the kids back to school.
Mr. Andre de Bruin from the Educators Union of South Africa, welcome. Thank you for joining us this afternoon. There have been some unions that are in support of primary school children going back to school full-time. But as the Educators Union of South Africa, what are your concerns regarding this?
Thank you so much for having me. We are of the opinion that lives should matter. More than 400 children died already from this disease. I mean, if I take it just in Western Cape, in the past week, on the 1st of June, there was a newspaper article which stated 61 teachers and 66 learners were positive in the Western Cape. 16 schools needed to close for sanitizing. In the 31st of May, also in a newspaper, 264 positive cases in 1 week at Northern Cape schools. We have 32 cases at one school. We have an adjacent creche who has 2 positive cases at a creche. So I am totally in disagreement with the previous speaker, who seems to speak out of a position of privilege, because in most poorer schools, you have 50 kids in the class. Now they want 50 kids in the class. We cannot allow our teachers to be sitting ducks and to be picked off by COVID-19. You see the Deputy Minister of Education being vaccinated on TV. There was a big hoo-ha when Gogo Anzi was vaccinated. But what about the teachers on the front line? Now the minister is talking about getting teachers jabbed before the 26th of July. We need to be realistic. Not all health workers have been jabbed by now already. So we know in reality it's not going to happen. 3 million people have registered for over 60. They don't even have enough vaccines for those people. So how are they going to do jabbing for teachers before the 26th of July? We cannot allow more and more, I watched a program the other day on Morning Live, actually, when there was a doctor from the NICD, I think it is, who said more and more children are being tested positive and that it has a definite influence on younger children. So you sit with 50 kids in a class, and if you look at where these outbreaks happen at schools who participated in full sports, who had been doing full capacity back at their schools. I mean, I can give you names of these schools. That is where the outbreaks took place. Now, do we not learn? And the other problem that we have is, why is it two different sets of rules for our people? Why does certain schools, I'm not going to name them, have full capacities? They don't do screening. They don't do all those protocols. The kids are just free to walk into class as per normal. Why
Mr. De Bruyn, let me bring the professor in here. Professor, in as much as the likelihood of children contracting COVID-19 is much lower than that of adults, it is a fact that there are children who've contracted COVID-19, and in some instances they've died from COVID-19. Mr. De Bruyn just brought up the issue of teachers as well, who have for the longest time been wanting to be considered as frontline workers, also wanting to be considered for vaccination as a priority. Now, that has not yet become a reality. How rife and stringent is the testing of pupils at schools, if at all?
Okay, so let's do the kids first. I really hear what Mr. De Bruyn is saying. I am a pediatrician who works in a community where there are lots of really poor children, and I understand his anxiety. Having said that, we have had very few children that have died of COVID. So in the hospital I've worked in, we have had only 4 children who have all had comorbidities. So what we are seeing is that kids are just reflecting what's going on in the community. So if they come to a hospital and they test positive, often they've got a broken arm, they've been involved in a car accident. So I hear that there are kids being tested in schools and teachers being tested in schools, but it is reflective of what is actually going on in the community. Regarding sports, we've looked at that very closely, and it seems to be, as we know, this virus is not easily transmitted in the open air, but it seems to be related to the pre- and post-sport socializing. So as you know, if somebody plays a match or they play a game, there's lots of kids afterwards drinking cool drinks together, masks are down. That's the time when people are vulnerable. And also possibly parents are also around with masks down. So I understand the concern about sport, but we think it's not actually the sport itself, but more the socializing before and afterwards. And very few kids, if you look at the real numbers, have actually died of COVID. Those that have died have had often long-term chronic illnesses and were on a palliative care plan because they had chronic illnesses. I also understand the situation with the teachers. I fully support that teachers should be vaccinated. I think that's an excellent idea. But what we're saying is that if you are going to be opening schools, everybody needs to be wearing a mask. Distancing, there's studies out of America who are way ahead of us in terms of the curve that have shown that actually 1 meter is as safe as 1.5 meters, considering that people wear masks, they do their hand sanitizing, and if your child is sick, don't send them to school. If you are sick as a teacher, if you are sick as a worker wherever you work, don't go to work because you are going to spread this condition. But if you look outside at the social distancing that's happening, people are running around in shops without masks, people are in restaurants without masks, and we're just saying the poor kids are the ones that are going to suffer. The primary school kids are not going to get life-threatening COVID on the whole, but they are going to lose out on education. And so we're saying, let's be safe. Let's try and get those teachers vaccinated as much as possible. Let's make sure we follow the 3 golden rules and get them back into school. And if we are concerned about some contact sport, then get the kids not to do intense contact sport, but rather do other healthy sport like running around, athletics and gym. So
as we wrap up, Mr. De Bruyn, the horse has bolted. The primary school children will be going back to school on a full-time basis. Do you believe that perhaps children who are not well physically, who may be predisposed to contracting not only COVID-19 but other diseases as well. Do you believe that perhaps special provision should be made for those children?
Let me answer you like this. The professor spoke of safety at schools. There's no safety at school. There's no PPE at school.
What she was talking about was the wearing of masks and the sanitation, as she mentioned earlier on. Are you with us, Professor?
I am with you.
Mr. De Bruin, unfortunately, it looks like your line is now frozen. We are going to leave our conversation here for this afternoon, but thank you to both of you for coming through and for putting forward your views. That there is Professor Makalich as well as Mr. Andre De Bruin, just two different views on whether or not it is safe for primary school children to return to school full-time. Certainly a question that many parents are asking themselves.